This is The O Factor, a new podcast with the intent to educate, inspire, and build trust with our communities. I'm Dr. O, your host. On today's episode, we will be discussing dental habits, patient connection, and how to love your health. On today's episode, we have with us Dr. Sheila Lemelle-Love. She grew up in Los Angeles to parents from farming communities in Louisiana. She attended USC undergraduate program and the dental program because it was a dream of her father that one of his children attended the university in their neighborhood. That's quite the story there. Being an LA native, it was only natural that she root for the Dodgers. I hear they won some World Series lately, so that's good for them. Her family is very important to her, and she raised her 7 children to give back to their community. Dr. Love enjoys riding Harleys with her husband, scrapbooking, and spending time with grandchildren and great-grandchildren. You're a very lucky woman. And we are very lucky to have you here with us.
Thank you so much.
Today. So I appreciate that you said yes to being here with us today. And you know, we have a tradition that we're starting with this. This is our 5th episode now, and asking my guests to pick a bobblehead from my collection here. I see that you picked Scooby-Doo, so do you mind sharing with us why you were drawn to that one in particular?
Once I saw Scooby, that was it. I grew up watching the cartoons. My kids had the Scooby-Doo Legos. I like everything about Scooby. Oh.
That's good. I grew up watching that too as well. So it's a pretty iconic dog, like many famous dogs. So very good. Well, we're gonna go through just a series of questions, have a conversation, and go from there. So I want to see how much do we can share with our audience about the links that exist between oral pathogens and oral health and cardiovascular disease.
There is a solid body of evidence that links oral pathogens to cardiovascular disease. In particular, periodontitis is a culprit. It can get into the bloodstream just by brushing your teeth, by chewing, or having any kind of dental procedure. And it can upset the balance and stability of the cardiovascular system by building up plaques.
Yeah, no, I think it's something that we oftentimes don't. Some patients don't realize that, right? And even I've seen opportunities for just the medical community in general, right? So how we, at least for us here as an organization, we have ways to detect and see like, oh, have you gone to see your dentist? Like, make sure you do this, and the other way around. It's very important that we have that partnership and collaboration. A lot of, we oftentimes, even other chronic diseases, right? So we're talking about cardiovascular health, but obesity and many other things that a lot starts with your mouth, right? So, I oftentimes see patients that, they go and see someone and they're, in the medical world and like, oh, I went to see my doctor for this and that. And they'll come from another clinic or a specialty appointment or something. And, there was no exam. There was nobody's touching them or examining them. Are you looking? I make a habit of always looking in the mouth, no matter what they're here for. And and then they're here for a knee pain or whatever it is. And it takes me 30 seconds to run through a very quick exam and pointing things out, and then encourage them to see their dentist as well. So I think it's very important that everyone is aware and they come and see you, and it's important to have that link. There's a lot of data and things that talk about that for sure. When it comes to specific foods and something that a lot of people talk about, we hear the sticky foods or sodas and all sorts of things. What kind of tips or information do you have to share about foods?
For the teeth, sticky foods is the worst villain ever. The stickiness just sticks on the teeth and the gums, and it continuously releases bacteria or feeds the bacteria in your mouth for hours and hours. That's why it's not really the best idea to eat the sticky foods. I don't even know why they make it, but soda's also bad too. Not so much for the teeth because it washes away, unlike the sticky foods, but for the body, it's empty calories, no nutrition whatsoever. It's like liquid sugar.
Yeah. Yeah, I oftentimes, I heard this from someone else, right? But I apply this to myself and with my patients that don't drink your calories, right? So like, let's just try to water and other different types of drinks that you can try as opposed to those. But it's very common. I'm sure you have the same conversations with your patients because you actually can see, right? What's like, oh, I can see that you're drinking a lot of this or that, or like smoking and all of those bad habits that oftentimes people have.
Oh, yes.
On the other hand, like, are there specific foods that you recommend to add more of for when it comes to oral health and your teeth?
Definitely. Dairy foods helps to coat the teeth and prevent bacteria from getting through. Leafy greens, always good, always good. Crunchy fruits and vegetable. It's like having a toothbrush, and you're not even in the bathroom. It'll clean off the teeth. It's good fiber for the body. What else? Believe it or not, garlic and onions. They suppress a lot of the bacteria from actually making cavities. Black and green tea is excellent. Excellent. It has natural fluoride in it. Just all I could keep going on and on. Do you want me to?
No, I mean, those are great things. And you mentioned fluoride. That has also been a topic of conversation recently as well. Sounds to me like that's something important for your teeth, right?
It's very important. For the young ones who can't spit out the toothpaste, okay, non-fluoridated or natural toothpaste is good. But before they go to bed, if you just use a grain of toothpaste the size of a grain of sand or rice, and just brush it on and let it stay, that fluoride will act for a few hours. Actually, I recommend after you brush, don't rinse. Leave the suds on.
Yeah.
Yeah.
Those are good, important tips. Are there any kind of like whispers or that our body tells us that we should listen to when it comes to just like oral health in general?
There are. Bad breath. It could be sinuses. It could be an infection. Chronic ulcers. If you have chronic ulcers, that can be a concern. It could indicate a systemic origin.
What about canker sores?
Canker sores, if you have them once every blue moon, not a big deal, especially if you jab yourself with something or have something spicy or you're stressed out. It's not a big deal. But if it continuously shows up, especially in the same spot, then it's a concern. You should see your dentist.
Okay. Those are good tips. So, I'm thinking about and everything you're saying, and recently, just last week, for the first time in my life, I tried something that I've kept hearing from different people, and like I would see all over the place about that, like, oh, like this is such a good, I think it's a dessert, like sticky mango rice or mango sticky, I don't even know what the actual name is, but like it was this weird thing where like sticky rice and mango, and I'm like, it was so good, it was delicious. I'm like, it sounds like maybe I shouldn't eat too much of that, or is that not the kind of sticky food?
If you're eating it with a meal and you're having a beverage, especially water, it's not a big deal. If you're eating it for snack or snacking on it throughout the day,
and then you just keep going.
Yep, that's not a good thing.
That's a good tip, because I kind of want to have some more.
With a meal.
All right. So we see, speaking of me seeing things on different places, social media, and hearing from different people, right? So we oftentimes see different trends that pop up in in health and you see a lot of this in social media specifically as well, from like oil pulling to charcoal toothpaste and like all sorts of different things. what's one that has some clinical merit, and which ones do you almost roll your eyes at, like you just did?
Oil pulling has some merit, and that's when you use like a coconut or sesame oil and you put some in your mouth and rinse for 10 or 20 minutes and then spit it out. It can prevent some bacteria, freshen your breath, but it just doesn't take the place of brushing and flossing. So yeah, if you want to do it, but it, eh. And charcoal. Did you say charcoal?
Yeah, that's what I've seen too.
The claims are charcoal will whiten the teeth. And sure, it's pretty abrasive. It can strip off your enamel. It can take off the surface stains maybe, but overall, it's not a good idea. It's just too abrasive. It'll hurt your enamel. So brushing and flossing.
Yeah, no, I think those are, and for everyone in general, right? So like I've seen people that, I have sometimes difficulties with like my own daughter trying to like brush for the appropriate amount of time, right? And like sometimes I'm in a hurry and I think I've tried to find different ways. Now someone recommended me to like do some exercises for like my ankle. Like I'm working on like strengthening my ankle from like an injury I had. And, I'm like supposed to like hold this position for a couple minutes while I'm doing something else. So like, what is the recommended time that you brush your teeth for? Like what do you tell your patients?
Minimum 2 minutes. Always 2 minutes. Brush gently. You want to brush longer, not harder. You don't want to damage your gums. You want to brush in a circular motion and kind of angle your toothbrush towards the gums. So you don't want to brush flat or up and down. You want to angle it and do circles.
Sounds very complicated.
It's really easy.
I know. But what about electric toothbrushes? Like what's the ideal patient, or who do you recommend that for?
People with arthritis, people who cannot manipulate a brush, because you don't want to help the electric brush do its work. You just want to move it slowly, and you still have to keep it at that angle, towards 45-degree angle towards the gums. But anybody can use an electric toothbrush. Anybody can use a manual toothbrush. It's just technique. Ask your dentist.
It's good. Should come and see you so you can, because there's like different cases, right? Like people have different things, and also the type of toothbrush, right? Because there's like soft and medium and hard, like different. There's it's not just the universal like use this, right? Like you need to come have an evaluation and hear from the expert what is the recommendation for your particular case, right?
Always a soft toothbrush. Hard toothbrushes, medium toothbrushes, I think they're made to scrub tile. I seriously do.
There you go.
If you are a hard brusher and you're using a harder toothbrush, you're going to make the gums recede, and then when the root surface shows, you're going to start wearing that away, and then it gets sensitive.
Yeah, that's good, because I've heard some other things in the past, so that's good information as well. What about like any recommendations, or like, oftentimes people they'll come and see us sometimes. We're like, oh, like I'm clenching my teeth or grinding the teeth, and like I have pain here and this and that. And, I'll do an exam, I'll ask questions, and I'm like, when was the last time you saw a dentist, right? But like, what are some like tips or recommendations or anything around those particular problems?
Get one of the Calm apps. Do meditation. A lot of it is stress-based. So, and then, of course, we always recommend using a mouth guard or an occlusal guard at night. Sleep with it, because if you're worrying about something or stressing out, you're going to clench your teeth or grind them during the night. It's also a good idea to wear them when you're doing sports, any kind of sports. Lifting weights, wear a mouth guard.
Can probably do more of that.
Yeah, think about it. When you're lifting, you're clenching. So.
Yeah, you're right. This is good.
What do
you recommend patients do prior to their appointments? And also, what do you find helps build their relationship and helps them feel more comfortable bringing up uncomfortable topics, right? I can share and tell you that for a long time, I used to like not go to the dentist. I was afraid of like the sound and like I would just get PTSD from like growing up, and obviously started having many issues. And I was like, okay, no more. Like I have to go. Like I'm telling and recommending patients to do this. And some years ago I started doing that. In fact, when I started working here, I had braces, and as an adult, and like I never had them growing up, and like I just wasn't necessarily practicing what I preach and recommending people to do that. But what recommendations you have, like both prior to the appointment and just in general, to encourage people to come and see their dentist?
So prior to the appointment, you should get together your insurance information, all your health information, what kind of medicines you take, and then write down any questions that you have or that you want to ask. Nothing is too embarrassing. We've heard it all. Believe me. You're not alone. So something that you may have been wondering about, a bump or anything, ask. And then we can help you. When you're at the dental appointment, know that we know most people are scared because it's a small area and it's very sensitive. So if you ask the dentist to let you know what they're doing before they do it, it's good. I usually do that, and then some people say, don't tell me, I don't want to know what's going on. But I will tell them step by step. We'll talk first. I want to know if you've had any trauma as a child, because that does make a difference how we would approach you. If you don't like the noise of the drill, bring earbuds. Yeah. Turn them up.
Yeah. Listen to some music, like do something else.
Yeah.
Yeah. No, those are great tips. I think I think it's hit or miss, right? So like I'm trying to always have those conversations with patients and ask them like when was the last time they saw someone, whether I find things or not. And I would say the majority of them will say like, oh, I saw someone, or I have an appointment, or I do have a dentist, but some are like, oh no, I'm afraid. And I think I can use some of that to also share with them, and just so they can sort of put those things into practice and then just show up, right? Because for a lot of people, like they just, and I'm sure you've seen a lot of patients that like haven't seen, I don't know if you have any stories about like what's the longest that a patient like I haven't been to a dentist in 20 years or like something like that. Like does anything?
Some 60-year-olds have never been to a dentist.
Never in their life. Wow.
Never.
Okay.
And yeah, it makes me sad, but the more that you go regularly to a dentist, the less problems you have in your mouth. The more chance that we can find something before it gets big. You don't have to have pain.
Just prevention, right? So like, and on that note, like how often do you recommend that people come, even if they have nothing going on? Like what's a good measure of prevention? Like how often should they come and see you?
The recommendation is every 6 months. Of course, some insurance say once a year. For children, it could be anywhere from 3, 4, 6 months. So it just depends on what the patient actually needs.
Okay. So it sounds like, when it comes to, I mentioned, say before, like you can ask any questions that come, like there's no such thing as a small problem where like we're listening to them. We're not going to judge on what like they're coming for and what they're saying. So I think that's the culture of like, of us as an organization, of like, as well as you put this into practice and like, come and see me. Right. So I think it's great when they see someone that, because oftentimes it's like, oh, like then they're like wearing all the things and you're covered and like, you're like, oh my God, I'm afraid. And like, so you just make it, so easy, like for inviting for people to come and do that. Because again, it can be, whether it's the sound or some sort of traumatic experience they've had in the past, like some people don't enjoy going to the dentist. Yeah. I also get a lot of people who don't like coming to the doctor, and like I don't blame you. I always joke with patients, and like, how are you doing? And I'm like, wait, like you're not doing so great, or else you wouldn't be here, right?
Exactly.
But we also want them to come when they're healthy for prevention. The same thing as you're saying, to do screenings and different things to get ahead of whatever can come in the future. So I think that's important. I want to sort of close with some final thoughts here, and and ask you if you could refer your patients or the community in general for another screening aside from dental, what would it be?
I would want all of my patients to see their primary care physician, to get screened for diabetes, to get screened for blood pressure, colorectal cancer, prostate, pap smears, everything that they should be doing regularly so that we know that they're healthy, so that they know that they're healthy.
Yeah. No, those are great recommendations, and I think as a patient-centered medical home, right? So we have like co-located of like having dental and behavioral health and women's health, and like we primary care can do a lot of those things. So in one appointment, you can do many of those things, right? So we'll see an appointment that a patient that's coming for their physical, or they can come for knee pain, back pain, and then they'll hear from one of our staff, right? So like, or if you're due for a colon cancer screening, like here's a test, and we can do this. If you're due for, breast cancer screening, here's an order. We can schedule you for a pap smear, and I think that's something that's our culture. And no matter what you're here for, like we're going to talk to you about it. And ultimately, patients make their own decisions. But I think they're at least going to hear that from, doesn't matter who they're seeing, right? So they can come to the mental health department, and they're going to talk to them about their blood pressure and other things as well. So we do this. It's a collaborative approach, and
Yes.
we're here to serve everyone. So I think that's great.
I'm glad you brought that up. If they have a phobia for dental, they can always see our behavioral health department.
Right, so that's a problem, right? Like
Yes.
that's an actual thing, right? So it's not just like people saying like, "Oh, I'm anxious." Well, that can also be treated, right? Like going to the dentist or thinking of going to the doctor or thinking of going to the dentist makes me anxious. Those things can be treated, right? Or like your blood pressure, like, "Oh, I don't like my blood pressure is high every time." Like that's a problem as well, right? So we have different resources that we can help patients with, and understanding that we all talk to each other. We're all looking at the same medical record, right? So I can see if somebody went to see you, like I can see the note, and I can like, oh, I saw that you saw Dr. Love, and like how'd that go, and the other way around, right? So I think it's very important that people understand that that's the approach we take and how we care for the whole person, right? From the nutrition, like we've touched on a lot of things, although you're a dentist and you're talking about oral health, like you see the importance of the whole person care, right? Of like the nutrition and the physical activity, prevention care, and trying to get ahead of some of those things. So, because oftentimes we're like, yeah, I'm doing fine. Like I don't need to see a doctor. That unfortunately life doesn't work that way, but we're here for anything and everything. Thank you so much for joining us on this episode. It's been a pleasure to have you here and to talk about and share a little bit about your expertise. And I mean, I'm sure we can be here for hours and talk about like the different cases and patient stories and different things that you've had throughout your career. And we appreciate everything you do here for our patients. And, we want to continue to see you grow here with us, and not just, it's something I didn't mention, right? So you're one of our lead clinicians as well, right? So you don't only see patients, but you're a leader in others. You support others, and you help them grow as well. So I think you play a key role in everything that we do here at TrueCare. So I just want to thank you for that as well.
Thank you. And remember, the mouth is the gateway to your body.
Go. There are a lot of myths and misconceptions in medicine. Today, we'll be answering some submissions from our audience. This is Myth in Medicine. The first question that we got was, does mouthwash work as a substitute for flossing? The answer is no, although mouthwash can be helpful in certain situations and encourage people to use that as well. It is definitely not a substitute for flossing. Flossing can definitely physically remove plaque and food debris between the teeth and the gum line. Mouthwash doesn't do this. So I certainly encourage people to floss. Another question we have is, do I really need to wear sunscreen in the winter? The answer is yes. UV rays don't disappear when it's cold or cloudy. Up to 80% of those can still penetrate and get through our skin. And remember that the exposure to UV rays is cumulative. So even if it's a little bit here, a little bit there, it can certainly cause some skin damage. So I would highly encourage people to still wear sunscreen during the winter. Have a burning question? Type it down below. Thanks for tuning in. Remember, insurance, no problem. TrueCare is here for all.